Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Kanchana. She is going to talk about preemies and micropreemies care, a journey in NICU towards intact survival. So stick around until the end, ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you. A warm welcome to everyone present here who are listening to the webinar. Actually, why we wanted to discuss about the prematurity and the preterm birth. Now everyone know because of in this era, because of many medical advancement, and there is a most important role in the premature babies. Like there is a increase in the premature deliveries and all nowadays because Um, so because of that, actually everyone should be aware like what is like a prematurity and what is preterm birth and is there any role of any role to reduce like that. So everyone knows like a prematurity is because they're like a small babies delivered before. So why we wanted to know prematurity means like now because in the advancement of the field usually before and all there's a chances all premature babies like if it is less than 1 kg and all in some 20-30 years before they will die, they would have died now. But since like because of the advancement and all now it is improved by giving the better premature preterm care, so we can reduce 50 to 80 percentage of the infant mortality. So that's why it is very very important to know at least basic about what is prematurity and how the preterm babies can be helped in our NICU. So coming to that, like what is prematurity? So every like it is the normal gestational age is around some 40 weeks. So 40 weeks or like it is like a 280 days or 10 lunar months means like a 9 months and 7 days. Even this time is very much needed for the any baby to improve, like any baby to grow, mature and develop. So if anything like abnormal, like if they are like if they come very early, there is a chance like this babies and all they can there is a lots of complication because of that. So a normal gestational age is like a 40 weeks. So if it is like any baby delivered before 37 weeks is like a preterm baby, and it is based on the size, weight, gestational age. It is further classified into extreme low birth weight or extreme premature babies if it is born less than 28 weeks. And nowadays even like a micro preemies and the nano preemies also they are in the team whenever any preterm baby if it is delivered before like 26 weeks or it is weight only around or 750 grams, that preemies are called as like micro preemies. And whenever any baby like delivered before 24 weeks and the weight is like only 100 grams, it is called as nano preemies. And now because of the advancement, even that micro and the nano preemies also like they are like able to survive after a struggle in the NICU. So whenever it is like after 28 to 32 weeks, it is called as very preterms, and after 38 week, it is like moderate preterms, and after 34 weeks, like a late preterms. And this preterm babies like why like all like before like preterms are delivered. So for that we should have an answer like now because of the changing lifestyles and like late marriages, and sometimes because of the complications assistive reproductive technologies, because of that multiple gestations, they are the common reasons like why now it is like improved, now it is like increasing the preterm incidence. But actually like a preterm birth whenever like a preterm is there, so either like a two like usually it will be like a indicated or indicated preterms or like a spontaneous onset of preterms. In preterm birth usually whenever there's an infection in the mother, there is a chance like a preterm birth will happen because of the infection. And in some cases it is like indicated preterms. In that cases like whenever mother is having some risk factors, like whenever continuing the pregnancy will cause more harm to the pregnant mothers, like whenever mother is like a PAH, like pregnancy induced hypertension, mother is like having convulsions. In that cases we need to terminate the pregnancy just to save both the baby and the mother. And in this cases actually we should diagnose what is before delivering or before terminating the pregnancy, we should have some methods to improve the outcome by giving some surfactant and whatever it is needed like that. So and in some cases like if continuing of the pregnancy in the uterus will harm the baby, fetal growth restriction. In that case, there is not a good blood supply from the mother to the baby. So in that cases also we need to stop, we need to terminate. So otherwise, like there is a chance there that babies can die even in utero. So in these cases and all, we have to terminate the pregnancy just to save the baby. And in some cases, if it is like infections and all, like we need to treat the infection just to prolong. Next question is it possible to avoid or prevent a preterm birth? So preventing a preterm complication, it is very difficult, but we can avoid the preterm births by, there is usually whenever the prevention treatment, if it comes, it is like a three level tiers. Like it is like a primary prevention, which means like whenever like it is like intended to all women, like all adolescent age. So we have to improve the nutritional status of the mother or status of the adolescent girl. So in that cases we need to we can prevent the preterm births. There is like a secondary prevention. It is like intended to improve the health of the woman who is already having the risk factors, like mother with a GDM. So in that case, first 3 months it is very needed. Like that is very needed for the organogenesis and also in that phase, if it is not controlled, there is a chance for the preterm birth and there is a complication in the delivery. So before that, so every mother has to go for every mother or woman who is planning for a pregnancy has to have like pre-conception counseling. In that we have to assess like what is the problem, like what is the risk factors for the mother. If any identifiable risk factors, any correctable, we have to correct, like obesity. If like weight is like a high, there is a chances for premature babies, and in that cases we can reduce the weight. If GDM, gestational diabetes and all, if it is like expected, like because of the fasting family history, in that cases we can reduce, we can control the sugar levels by giving the medicines. Even blood pressure is also controlled in the previous time. So next, coming on to what are the health issues of a premature babies. So all know like a preterm babies are not a small term babies. Like usually we'll tell like children are not a small adult. Same like that. Premature babies are completely different from the term babies. Actually, preterm babies, they will be having the background network, means like they will be having all the organs. It is like well formed, but what will happen means like this that organs will be there, but it won't be like, it will be functional but it will not mature. So if any preterm baby, if it is like delivered less than 28 weeks, they will not be ready to take the milk. So in that cases they will need some support. So the common or like most significant problems or health issues in the premature babies are actually breathing difficulties, because last trimester is very much needed for the lungs to improve and develop. Surfactant is very important, protein which is secreted in the lungs, which is important for the lungs to mature and lungs to expand. So in this cases that will be less. So after a birth they will be having respiratory distress syndrome, which means like a breathing difficulty, and after that they will be having issues with the brain development, means like intraventricular hemorrhage they can have in some cases, and the feeding issues they will be having. Even the eyes and all, it will be in the developing stage, so there is a chances for retinopathy or prematurity, which is a complication of the preterm delivery, and other minor issues like anemia and bone immaturities and feeding problems and all will be there. Next. Next, what are this issues like now we know like what are the health problems of the premature babies. Now like many interventions are done like to improve the outcome of the premature babies. So how to improve that outcomes? So whenever like usually whenever like high risk deliveries are there, it has to be like done in some high facility centers, means like tertiary care centers. So this doesn't mean like all deliveries has to be done in the tertiary level center. So whenever there is like a high risk deliveries, like less than 32 week or expected extreme low birth weight, like less than 1 kg baby, that should be delivered, because like in utero transfer is very safe for the baby. Instead, like after delivery from some secondary centers and shifting to the primary centers, like tertiary centers. So in that cases, like in utero transfer to the facility where the preterm can be handled better, and interventions usually like we will divide like whenever before delivery of the baby and after the delivery and in the NICU. So before delivery, actually like important in like management strategies, like whenever any mother is admitted with a preterm delivery, like we have to give like antenatal corticosteroids for the mother to improve the lung maturity of the babies. And same thing, like to improve the neurological maturity, so we have to give magnesium sulfate injection to the mother. That will improve the neurological maturity, and it reduces the neurological impairment when it grows. And after that, if there is any infection, we need to give antibiotics to the mother to improve at least to improve the infection, like to prevent the sepsis in the newborn. And also, if because of that only, if in some cases there is a chances of premature rupture of membrane, in that cases we can prolong, like at least over 2 to 3 days. In that case, we can buy the time for the steroids and max self injections. So what I'm telling is, like whenever it is needed, like it has to be babies like with high risk has to be delivered in some centers. There, like some facilities are there to monitor and take care of the antenatal mothers to improve the outcome of the premature babies. And during delivery of the baby, that neonatologist team has to be informed, and they one trained NRP trained doctor and at least one or two sisters has to be there. So because like whenever baby delivers at birth, the first golden hour management is very very important. That affects the mortality, morbidity, and outcome of the baby. So, any high risk premature baby, it is handled in a tertiary level center with good support. Everything should be ready before the delivery. In that cases, we can have the good outcome. So, what are the golden hour management? Whenever like babies in the uterus, babies will not breathe because they are underwater. So usually mother is breathing and the oxygen is supplied through the umbilical cord. Whenever immediately after birth, they have to start breathing. So that is very important for the baby to sustain their life. So if suppose if baby is very small, like as for example 26 weeker, or if it is only like a 700-gram baby, if it is not able to breathe on its own, we need to support. So how many seconds or minutes like we are making the baby to breathe on its own, that makes a difference in the outcome. So that comes the role of like delivery room CPAP. Whenever it is needed, all babies, whenever it is not breathing on its own, we have to support with a continuous positive airway pressure. And the most important thing, other important management strategy to improve the outcome is the thermoregulation, which means like whenever the baby comes out, it will be cold, and if the temperature is not maintained properly, it will affect the system. So we need to control the temperature by making the warm rooms, and baby has to be received in the warm radiant warmer, received under the radiant warmer, and the baby has to be wiped if it is like more than 32 weekers, and if it is less than 32 weeker, it has to be received in the plastic wrap. And within first hour temperature is very very important. If first hour in temperature is like normal, if normal temperature, if we are able to control the temperature at least in the first hour, it tells like there is a possibility of the neonatal outcome is better. And the next interventions, like after shifting to NICU, the golden hour management includes like glucose and glucose. Golden hour management, it includes we need to start the parental nutrition immediately in the first 1 hour of life, because babies needs glucose and all other nutritions. And what will be the journey of preemies and their parents in NICU? And all knows like whenever the preemies, the two like a micro preemies and the nano preemies, if it is like 28 weeker, the baby will need like NICU care for 2 to 3 months based on the severity of the condition and based on the risk factors what it had and based on the respiratory support. So the journey will be ups and downs. It won't be like a smooth. Then also the both the babies and the parents have to go through that to get a positive response. So premature babies, whenever they are in the NICU, initially we'll start the babies like based on the severity of the respiratory distress. We'll start and the support. Some babies they will be on ventilator. Some babies will need only continue positive pressure, positive airway pressure, and some babies they will need only HFNC. So gradually, like we have to see all the response, all the systems, how it is like working. And respiratory system wise, like usually some babies will only need like ventilator support. Some babies, if it is like lungs are premature, we have one injection called like surfactant that can be given for the babies to improve the lung maturity. And after total parenteral nutritions, this babies will need feeding will be started like based on the severity. If it is like less than 28 week, usually we'll start with the IV fluids and gradually we'll taper and we'll increase to the we'll start the total enteral nutrition from either breast milk or the donor human milk. If it is a more than 32 week baby, this baby can be started initially with the breastfeed, initially with the mother's milk, and it is usually given initially with the tube feeds, and gradually it can be changed to pallida, and then my baby can take directly. And after this, like how parents can participate in the care of their babies. Usually like in NICU it is like a long journey, so parents also has to involve in the journey of the baby. So parents like feeding, like a mother can give the feeding. So whenever like in NICU every time like a mother can be involved in the diaper change, and she can come inside and she can give the feeding to the baby. And initial times like whenever the baby is like stable, we'll start like a kangaroo mother care. And like usually we'll inform the condition of the babies to the of our parents, and we'll take that informed decisions whenever the decision is needed based on the risk factors. And next, like what is a developmental supportive care? So then like actually like NICU, it is not only about getting the baby out. It is the baby like intact survival of the baby is very much needed. It is dependent on like because there is like a harmful environment. Usually 40 weeks it is like very much needed, like a baby has to be in the uterus. That is very important for the baby's development, brain development. But developmentally, why this is very much important means like the last trimester and the first 3 months of the baby's life, it is very much needed for the cognitive development. And if it is baby is like developing in the harsh environment with like unnecessary exposure to vision, like hearing noises and all, it will disturb the development, and there is a chances this babies will be like violent in future. For that we need to have the structure and the healing environment in the NICU that will support the newborns, the whatever it is needed for the normal growth and development. So this has to be like followed in all NICUs, and it has like a 5 components. So baby should have like a protective sleep, which means like baby should have like undisturbed sleep for the normal development of the baby and maturity. And next important component is a family centered care, which means like parents should be involved for the informed decision making, and they should do like a KMC, kangaroo mother care. And whenever it is needed, if baby is like fine, we have to give like non-nutritive sucking. And they should be involved in each and every development of the baby. And third is like a healing environment. What means like a healing environment? It is like whenever the baby is in NICU, you should have the environment that is supportive for the normal growth and development, which means tactile stimulation should be like gentle and firm. There should not be too much light in the NICU. They should have like undisturbed sleep. So we should have like a clustering of activity, which means whenever there is a diaper change, feeding, everything, every daily activities has to be clustered, one and everything to clustered together, so that the baby can have an undisturbed sleep. And even the noise level at NICU has to be controlled at minimal level. So accepted level is like only 45 decibels. So if it is like increased level of this thing, there is a chances for the developmental abnormality of the baby. And next important is the assessment and the management of the pain and stress. So whenever the baby is like under stress, it will be there in the memory. So whenever we have like painful procedures like sampling, IV line insertion, or any other procedures, ROP screening, in that case, essentially we have to give like some skin to skin contact or some sugars, or like feeding the baby, so or to console the baby, and we need to swaddle the baby, so that will erase that negative memory from the baby, so that will help in the development of the baby. And the next thing is like the daily activities. So daily activities should be like clubbed together, and the baby should have a smooth environment. And this developmentally supportive care should begin as soon as the baby is admitted in NICU, and it should be continued even after discharge, even after home. So whenever the baby is ready for discharge, we should counsel the parents before discharge. So how to take care of the baby at home. So this everything includes a developmental supportive care. So whenever the baby is ready to discharge, the father and mother, they should know how to give palliative feeds, how to feed the baby, how to take care of the baby, and how to maintain the warmth even without warmers. And after that, there will be like a regular checkup for the high risk babies who are all discharged from NICU. If they are like a high risk baby, there is a chances for the ROP, which is a retinopathy of prematurity, and the developmental screening has to be done in frequent intervals. So all premature babies, and we'll tell them like NICU graduates, like they are like coming out of NICU after 2 to 3 months of NICU care. In that they would have struggled a lot. They will be having like lots of exposure, unnecessary exposure. So there is a high risk chance of babies getting some neurological impairment. So for that, we should have the babies in follow up. Like they should be regularly coming. Like usually after discharge, they have to come immediately after some 3 to 7 days of life, and after that, weekly, monthly once till 6 months. And after that, regular routine developmental assessment has to be done at a 3 months, 6 months, 9 months, 12 months, and 18 months, and 24 months. And ROP screening has to be done regularly whenever it is like initially, like we'll start at a 34 weeks, like whenever the baby born at 32 weeks, either at a 14 days if it is like less than 28 weeks, or if it is like a more than 28-week babies, like we will do at a 3 weeks of life. And after that, regularly we'll follow. Even after discharge also, they have to come. So all these procedures whenever we are doing, so if it is like followed properly, and if any deviation from the normal, we have to start the baby on early stimulation and physiotherapy. In that cases, we can able to reduce the neurological impairment to almost 30%. After all this advancement and the treatment in the neonatal intensive care unit, now because of the advancement of the medicine, now it is like we can able to reduce the neonatal impairment and the neurological dysfunction to a major level. So previously, the survival rate of 22-weeker or 24-weeker was almost nil. Now, even in the Indian context, also it is like the baby can develop like almost like 30% survival for 22 to 24-weeker babies. And after 24 to 26 weeks, there is like 50% survival rate is there. And after 28 weeks, there is like 90 plus percentage of survival rate is there with intact. So whenever the babies are less than 32 weekers and they need a higher support, they have to be cared properly in the NICU. In that cases, we can able to improve the outcome of the babies. So I hope as a team, like from the doctors team, like a neonatologist and the family members, when we all work together, and baby can come out without any neurological impairment. So I hope with the best treatment and the availability of the medicines and whatever it is needed in the best possible hands, there is a chances we can get an intact survival even in the extreme low birth weight babies. Thank you for your time.